Now here's our reporter, Laura Windsor, with a report on vaccinations.
Immunizations or vaccinations are a way to improve your immune system and prevent serious, life-threatening diseases. Dr. Cameo Carter, who practices pediatrics at Redlands Community Hospital, tells us the importance of vaccinations for children.
Well, certainly some of them are still very prevalent. We have pockets of pertussis, pockets of measles. Flu, of course, is something, influenza, we have every year. So there are certain illnesses like those that are still quite common and prevalent. There are others, such as polio, that are more prevalent in third world countries. We have study after study that's been well designed that has showed that vaccines are safe and effective and is one of the best things that you can do to protect your child. The first vaccination is usually given in the newborn period when they're in the hospital. Most babies receive a hepatitis B vaccination. Every year, some mothers falsely test negative to hepatitis B in their prenatal labs. And so that's one reason the hepatitis B is given right away to help protect those babies. That's the only vaccination that's given at birth. The next set begins at 2 months of age, and usually it's 3 pokes and 1 oral vaccine given at that time that protect against several different diseases. We used to think that immunity was, once you were immunized and you received your full series and your booster, that you were good for the rest of your life. And we found a few years ago that, in fact, our protection against pertussis was waning. And so we started immunizing children again at 11 years of age to help boost that protection against whooping cough. The main baby vaccines are done by 18 months of age. Then they get vaccinated again before they're in school. Ages 4 to 6 will get another set. And then again as they're going into junior high at 11 years of age. That's one of the times when you're getting boosted against the whooping cough, and that's the Tdap. So you get your tetanus booster, and pertussis is very important there. In addition, we have some newer vaccines that are very, very helpful. And when I say newer, they've come out within the last 10 years. Protection against meningitis, which is a very serious disease infecting the spinal fluid and the brain that can cause rapid death. And we now have good protection against it. So the meningococcal vaccine is another one given. Also the HPV vaccination, which is a big cause of cervical cancer, and now we can protect against that. So those are the main ones that are given at that age.
Are there any side effects to these vaccinations?
The most common ones are fever, warmth, swelling, irritation. I can say as a mom, fussiness was something that I commonly would see after vaccinations. It's not fun to see your child getting poked and having them cry from something that's inflicted. The alternative is so much worse. These things that we're able to protect children against can kill. They can make a child very sick, and if they survive, brain damage, loss of hearing, these are all serious things that can happen. So crying for a little bit, being sore and having a fever is much better to take care of from a parent standpoint for sure than these other dire consequences. Thankfully, the majority of people are still vaccinating their children, and that's one reason why I enjoy talking about this topic, to let people know that it's safe and that it's good and that's something that they should do for their children. There's still a few people who are wary, that are nervous and are concerned about, is this too many too soon to give my sweet newborn baby? And so we try to continue to work with them and help them be comfortable with the decisions that they're making.
Immunizations are one of the best means of protection against contagious diseases. If you have any questions or concerns on vaccinations, consult with your child's pediatrician. For the American Health Journal, I'm Laura Windsor.